Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster, with my guest here, Elianna Goldstein, CEO and co-founder at Modern Ritual. Thanks for joining me, Elianna.
Thank you for having me here, Logan.
It's a pleasure. It's been fun to watch your journey. As someone who should probably be more mindful of my skin health, and my wife's always telling me to wear sunscreen and get moles checked out, I appreciate the way that you're helping people think about their dermatological needs. So tell us about the company.
Well, Logan, you're not alone with that. And you could imagine the last time that you were at your primary care doctor, perhaps you had one of those moles or spots, maybe a rash.
I did.
You did. And that doctor said, we're going to refer you to a dermatologist. One of our providers we worked with recently said, it's going to be a 6-month wait till my local dermatologist could see that patient. Instead, with Modern Ritual, you would go home and you would hear within that same day back from your PCP, your care plan, your diagnosis, everything that you needed to know about your spot of concern, the exact same day. That's what we're doing at Modern Ritual.
Okay.
We're fixing the broken way that we are treating and managing for skin diseases today.
Okay. Let's talk about the challenges inherent in skin diseases, kind of the magnitude of the problem in 2023.
The majority of U.S. cities and counties do not have a dermatologist available to them today. This becomes especially problematic when we're talking about rural populations. Most patients on Medicaid have so much difficulty accessing a dermatologist, and it's simply not acceptable.
Yeah.
I saw this throughout the U.S. when we were starting our company, and that's specifically the problem that we were looking to tackle. How do we expand access to dermatology providers, but take a very localized approach in looking at where are there communities that really want and are seeking out new and innovative solutions to solve for this type of problem?
It's crazy. Culturally, when I think about it, dermatology has been treated like some special, extra, sort of treatment, versus like a piece of whole person care.
Completely. It truly is. You have two sides of dermatology. You, of course, have a lot of aesthetics, and then you also have general dermatology. And we often forget, yes, the skin is our body's largest organ,
That's right.
and yet we often can think about it very reactively. I have this new rash. And really our perspective is to start to treat our bodies in this proactive manner like we do when we eat well, we work out well. Well, we need to also look at our bodies and scan them. And if we see something that's new, not feel anxious that we can't get into a dermatologist, but realize that there are other options, like maybe going to your local Minute Clinic or your local primary care doctor to start to get an answer.
So you painted a picture of me going into my primary care doctor and getting a result the same day. So how does this magic take place through Modern Ritual? How is that possible?
Well, at Modern Ritual, we've created an incredibly simple solution for a very complex problem. So you as the patient, really, you have this incredibly wonderful and rich relationship with your primary care doctor, we hope. And we want to keep that relationship intact. Where we sit is on the back end. So we service that primary care doctor like a dermatologist next door. That's what we want to be for the PCP. So in this instance, the primary care doctor is taking a photo using what we call a scope, a high resolution camera device of the skin concern. They're sending that to us, Modern Ritual, through our virtual platform. And then one of our board certified dermatologists responds back that same day to the primary care doctor with a care plan, a diagnosis, and really what the next steps that PCP needs to take. It's, again, that collaborative approach to care that really solves for a lot of these problems.
Tell me your perspective on, a little bit more of a macro perspective on telederm, because I've been in this industry for 10, 15 years, and I've watched, it's been a popular area of innovation for a long time, back to the idea of taking a picture of a mole with your iPhone. There's been all these different attempts at telederm. So where are we at today, and kind of, why have we matured to this level that you're specifically suggesting?
We've seen this industry evolve on our team as well. My co-founder, my mother, has been a dermatologist for the last 30 years and a skin cancer surgeon for the last 10.
Okay.
And my father is a primary care doctor.
Okay.
And he has been in the industry the same amount of
Seeing
time.
the Venn diagrams all come together.
And you can imagine what this looked like for me in my life.
Yeah.
And what we saw when starting this company is that what I saw as a child, that there is a lot of problems that the PCP faces as a clinician, as a practitioner, that could really be better solved when they have a dermatologist in the room with them. And that's happening all across the country, not just in my own household, in my home. But to your question specifically, when we were looking to start this company, we looked at all of the solutions that had been pitched to my father or that my mother had seen come to market. And the clear gap that existed was a better imaging device and a better image algorithm that could help to reduce the likelihood that a dermatologist talking to the PCP says, it's not a good enough photo. Sorry, that patient still needs to come in person.
Yep.
That's really where the gap lies initially, and that's what we're solving for, making sure that the PCP is able to get the highest resolution photo of you, the patient, and that they're getting better answers back from our dermatology providers as compared to what they were seeing before with some of the other platforms.
Yeah, and I'm also hearing, this evolution towards supporting the provider versus going direct to consumer, because so many of those companies were iPhone apps. They were just sort of like, download this, and the algorithm will give you an answer. But then you didn't really get the resolution that you needed from your physician.
And at Modern Ritual, we think of the two factors that are most important when starting any company. It's business model and timing. And for us, we have a business model that's a win in the healthcare system. It's a win for payers because we're reducing the net cost of care. It's a win for patients. They're getting this rapid access to care they never had. And for the provider, they have this incredibly simple device that they love, and we love to hear they love using every single day. On the flip side, you have this timing after COVID where, to your point, there was a lot of direct-to-consumer growth. But for us, if we really want to have the greatest impact, we know that lies in this hybrid approach to care where you're not just having a digital solution, you're working with the local care provider who already has, like I said, that trusted relationship with their patients.
That's so key. What's your traction been like, and what are you looking forward to for the next maybe 6 months?
We launched with our first clinics earlier this year, and it's been incredible to see the adoption and growth over the last few months. We're now in over 150 doors, meaning 150 local primary care doctors across the entire United States.
Wow.
And we have board-certified dermatologists on our team who are licensed in all 50 states. Looking forward, we're incredibly excited about working with our payer partners and also with accountable care organizations to continue to roll out our service in their health systems and to bring this to thousands and eventually millions of patients across the United States.
You mentioned ACOs. Obviously, sort of cost reduction in that sort of value-based structure is important. How are you reducing cost?
Whenever you have a patient, we heard last week speaking with a leader, a chief medical officer at an ACO in Florida. And whenever a patient is referred out, they have over $1 million in dermatology spend because that patient may go to the ER. They may go and not get seen for 6 months.
Yeah.
Or they may have an incredibly expensive surgery that could have been so much less if it had been treated sooner.
Yeah.
Or within that primary care clinic. And so we're able to reduce the total number of visits in person for dermatology by up to 85%.
Wow.
And we're also able to, like I said before, improve the quality of life for these patients. And that's so key and critical as well, because when we think about this as a holistic care and patient journey, yes, we're looking at cost savings, which is first and foremost. But again, we go back to what's that experience for the provider using it and what's the experience for patients.
I got to ask, because your mother is a dermatologist, how do dermatologists feel about this? Are you cutting them out in any way? Or
We couldn't if we tried, because right now there is such a supply and demand challenge.
Got it. Okay.
Today, there is so much demand for dermatology. It's already skin cancer is the #1 cancer by volume over all other cancers combined. And yet we're seeing supply of dermatology, especially in rural communities, it's lacking so much.
Got it.
But most importantly, when we do a triage, we are telling the provider this patient might need to go in person to a dermatologist, and it's a very high acuity appointment. That means that every dermatologist is seeing, when they're getting a referred patient, the highest acuity patient. They're practicing at the top of their license, which is what every practitioner wants to do.
The right patient at the right place at the right time.
It's the only way that we'll see the right advancements in care is if we're thinking about care, as you said so well, Logan, the right care to the right patient with the right provider at the right time.
Awesome. Elianna, thank you for giving me this update. I love watching your progress. More than 100 doors, you said, and the next year is going to be very big for you guys, I'm sure.
We can't wait.
We'll be watching your progress. Thanks a lot
Thank
for coming
you,
by.
Logan.